Okay, so a few of you have asked some questions about how to approach pharmacology, and I decided to make just a brief video kind of attempting to put everything into perspective so that you can kind of make sense of it all. Um, and this kind of is a good example of probably what this feels like right now. It's just a list of drugs that I have to memorize for medical school, and it's kind of what we're looking at. It's a long list. There's lots of drugs out there. And what we do is we try to focus it on ones that are the most clinically relevant. Believe it or not, I've taken a lot of old, archaic drugs out of the curriculum. And you've probably seen this slide before, and I just want to reiterate that we're kind of in the distinction between, basic pharmacology, dealing with mechanism of action, side effects, toxicities, relating how a specific drug works in a specific disease state. And the textbooks that are listed there do a good job of kind of putting that into perspective. Kind of the newer applications of pharmacology are what we would call clinical pharmacology. And so a lot of this is evidence-based medicine. It's based on outcomes research. You can try to relate it sometimes to the mechanism of action, although it's not always possible. And basically, in terms of which drug should you prescribe, is kind of an ongoing um, process that does kind of change over time. The mechanisms, of course, stay the same, but as to why one drug is used more so than another is kind of a evolving process. And so what we do is we kind of expose you to that as we go through this curriculum. So the outline for pharmacology in the Rush Medical College looks like this. So you've got your student version of the CBCL, and that's kind of like the pre-session material. And this contains background reading or course notes, and it's the most general as you've seen it. And it's kind of like a broad overview of the major drug classes. And so, there's a chapter on penicillins, there's a chapter on cephalosporins, and so forth. And these are basically linked to those two textbooks in the previous diagram. And so here's the link for basic and clinical pharmacology, referred to as Katzung's textbook, and then kind of the girthier, more in-depth version, the pharmacological basis of therapeutics by Goodman and Gilman, and the link is shown there. And so these textbooks are kind of like the prototype textbooks for professional education. So pharmacy, medicine, dentistry, veterinary medicine, and so forth. These are the books that are kind of the go-to books. And they're basic pharmacology. So they talk about drugs, receptors, and drug classes that are based on a common mechanism of action. All right. And so the topics that are in the what I would call the pre-session or the pre-reading materials are very broad, as I said before. And the things that you should be looking at include, the mechanism of action of this particular drug class. And so the example here is cephalosporin. So they all have the same mechanism of action. But then there's divisions within this drug class. And so the divisions in the antibiotics are typically denoted as first, second, third, fourth generation. And you can see that in the literature, there are some unique aspects to each division, whether we talk about coverage for a specific subtype of bacteria, the ability of this particular antibiotic class to be used for gram negatives or gram positive. Those are kind of the unique aspects that go along with each division. And of course, within these broad categories are like the most commonly encountered or the most commonly reported side effects. And here's where we start to see the clinical indications, what disease these antibiotics specifically treat, starting to be kind of demarcated or mentioned within the text. And so this is kind of like your first introduction to clinical pharmacology, and it's kind of a very brief and broad overview. So you do the broad kind of major topics at home, and then the clinical case discussions. And so these are the live sessions that you attend on Mondays and Thursdays. And so for pharmacology, usually this is accompanied by a small video that I've made with the patient's name. And so these drugs are indicated for the specific disease. And so I don't usually say what the disease is. I've said it earlier in the curriculum. I won't say it as often. And the process here is that you need to get the diagnosis of this particular disease within the session. So I can't give it to you. But understand that the antibiotics or the drugs that are in these clinical case videos, the ones that have the patient's name attached to them, these are very focused. And so you can see there's only maybe 3, 4, 5 antibiotics, and we go into much detail in terms of how they're used, how they're administered, their pharmacokinetics, the dosing guidelines, drug interactions, and so forth. And so here's where we kind of explore the nuances of these specific drugs within this broader category of drugs. And so you can't learn all of the different drugs within one category at once. And so what we do is we kind of break it up into different packages. And so how do you put this together? Excuse me. First of all, create a summary table, okay? Look at all of the background info and the pre-session material and start to combine that in a table. Draw on specific antibiotics that were mentioned from each of these sessions. And then as you kind of accumulate all of this material, you can put it together while you study through your step 1 guides and through independent study. And so this is what this table should start to look like. And these tables will get bigger as you go through the curriculum. And this is incomplete. So hopefully you can grab this table and fill it in. But put the class here on the left, the mechanism of action, and then examples. And so with penicillins, obviously there's generation 1, 2, 3, 4, and so forth. And then the clinical use. And so the clinical use, for the most part, will be blank. And then as you go through the various cases, and so this is not right, I just made this up when I did this. So case 1, case 2, case 5, you can see where we used penicillins throughout the specific cases, but try to draw the common drugs from each of these different cases. So, for example, case 1 would use maybe a penicillin, a cephalosporin, and a macrolide. Case 2 would only use maybe a penicillin and so forth. So, and what you can do is you can kind of rank all of your antibiotics based on their clinical use. And so, you can say for, something like disease X or disease Y, so Legionnaire's disease, Listeria, and so forth. And then, of course, the side effects, you can find them in the background materials. You can also see them in the session materials too, because we'll spend a little bit more time on specific side effects of all of these drugs. Okay, and so the looming question is, well, how does this relate to step 1? And so this is like, basically, we go through the introductory material, we go through specific antibiotics at the session level, and then as you go through step, you're kind of reviewing all this and you're assimilating all this knowledge. And so this summary chart basically describes what the next diagram is. As you go through your step prep, a lot of you have asked, are there specific practice questions? And so Katsung and Trevor, the pharmacology textbook, they have a step 1 practice board review guide. And so that link is here. So this is a different book, a different textbook than what's used in the Katsung arena. And so this has actually got really good questions and so forth, about a dozen questions for every different type of disease. And so if you want to put it all together, we'll start here at the most kind of rudimentary level. Here you've got your drug class, your mechanism of action, and your side effect. And this is going to be covered in the self-study material. The divisions within the drug classes, and then the different subtypes within each drug class will be covered on formatives and so forth. And then your clinical case session are basically discussions about specific drugs at the session level. And then as you go up this ladder, you'll start to be exposed to guidelines and rationales. These will be tested more in terms of a summative type of example. And then, of course, once you get to the proper treatment, so you've got the proper diagnosis and the correct group of antibiotics to treat it, you're passing step 1 and you're practicing medicine. So this is kind of a brief kind of overview of how to approach pharmacology. I hope you find it helpful. Please email me or come and see me with specific questions. But this is kind of the roadmap, so to speak, of where pharmacology is going. Okay, thank you.